My name is Jill Berry Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show, dedicated to discussing important healthcare topics of interest to our community. Today, I'm joined by Denise Smith, the new program manager for Rise Vermont, and Dr. Elizabeth Fontaine, who's the medical director of NMC's Lifestyle Medicine program and Rise Vermont. So welcome. Thank you for joining the show.
A pleasure.
Thank you.
We're going to have fun on this one because we're going to be Rising Vermont. So what a great topic. So before we get started, it's really important for folks to know who you are. So maybe you could both introduce yourself and a little bit about yourselves.
Do you want to go first, or you want me to start?
So like Jill says, I'm Dr. Elizabeth Fontaine. I've been in the community for 22 years now as an obstetrician gynecologist, and now I'm for the last 3 years, medical director of Lifestyle Medicine and newly Rise Vermont. So my background is in obesity and exercise, so that people can make connection and understand why I have so much interest into Rise Vermont and Lifestyle Medicine.
Excellent.
And I'm Denise Smith, and I'm the new program manager for the program of Rise Vermont. And I come from a bit of a mixed background, but what really attracts me to this program, I was part of the Community Committee on Healthy Lifestyles when the whole thing first started, and where Rise Vermont was born. And prior to that, I ran and operated a yoga studio in St. Albans for about 15 years. And then did a number of different things in between with grant writing and nonprofit management, so organizational development, and landed here, and I'm very grateful. And I've been the program manager since January.
It's been fantastic. You've brought new energy and new life, and it's just really exciting to have you as part of the team.
Thank you. I'm really enjoying it. It's great.
Well, so tell us, what is Rise Vermont, and what is Rise Vermont up to?
So Rise Vermont, the best way that I think we can describe this, it's a community collaborative that really inspires healthy lifestyles. We're trying to inspire people to make the healthy choice, and to do that, we're facilitating these choices to be easier. And so that's really what we're doing, and that's what we're all about. And we do that through so many different ways, but our key component of our program is having embedded community members that are part of our team, and they're just fantastic. And they're working at all of the different levels of our society. So they're working in the workplaces, they're working in the schools, and they're working with municipal governments. And then in addition to that, we have a health coach on our team that works with individuals who might be looking at trying to make a lifestyle change.
Wow.
Yeah.
That's a lot of
It's
stuff.
a lot.
So Dr. Fontaine, when you think about your role as the medical director and health coaching, talk a little bit about what your role is specific to this and the importance of health coaching.
Well, going from what Denise is saying, the importance of connecting the role of the physician with what's happening in the community. So oftentimes the individual will come to the office to see you, and it's the best time, and often we'll see that the physician has a good impact to try to help change in the health status of the individual. So trying to help an individual at one point in the office is very limited. So in order to help them to hopefully have sustainable change, having somebody that would be present potentially in the office as a health coach, so that at the point of service, so we can help them to start their change and connect them with Rise Vermont and the community would be just a fantastic way to sustain the change.
That's terrific. So you're coaching individuals and giving them a start, and then Rise Vermont's picking up in the community, and you're kind of coaching a community.
Coaching a community.
Yes.
That's a great way of wording
Well,
it.
actually, it's coaching a village to help. This is
Coaching a village
Better
to help.
said.
This is my vision. So I like the terminology.
I do too. That sounds great.
That's great.
Yeah, it is.
Okay, so things are popping up with Rise Vermont. Tell me about these show-up events. So what's the importance of those events?
So for me, I think the show-up event, so before I joined the team, there would be a host show-up event at 6 a.m. in Taylor Park. Free event, anybody, you just show up and you can exercise for, I think it was an hour long.
Yes.
And so for me, it's access. Here's a great opportunity to get up and get going, and you have access. It's free, it's in a free environment. Other people are going, so it kind of creates sort of this like buddy system. And you're doing it with your community. So, it's who's ever there that morning. And now we've expanded them, so we're not just doing them in St. Albans. They originally were a St. Albans thing. We're expanding them, and we're not just making them about exercise. We're doing a family bike, how to maintain a bike. We're doing this evening in Swanton. We have a cooking show up, so people can come and learn how to cook healthy foods. So we've kind of originally they were really kind of a boot camp sort of thing at 6 a.m. in Taylor Park, and now we're doing them in Enosburg and Swanton. I think there's yoga in the park this week in Enosburg, and so we're trying to expand and do different things to attract different people, so everybody is seeing that there's access to do something healthy and different in your community. So I think so that for me is really the importance of the Show Up events.
So how do you find people are able to sustain change? So we've got these events going on, so it's exciting and people get started, but behavior is hard to change long term. So maybe talk a little bit about that from your perspectives about how do we do this? How do we do this, especially since we already have our routines and everything? It's very hard. So so how do you make behavior change long lasting?
There's all sorts of theory regarding, how to sustain changes. So I think just to make it simple, I think that, it's something we call the power of habits. So, if you see your surrounding, if everything is organized so that this is the normal choice of doing something, the active way. If everybody goes to the Show Up event, if your friend is going, it's just to encourage you to keep going. So I don't want to go into theory because, you have this readiness to change and all these different steps that we can discuss. But if you just makes it an easy choice and everybody does it, it just makes it happen so that people just continue. So it is important that we do it at large, not oriented just as the individual, just to facilitate. I mean, that's a simple way to look at it.
Sure.
The more simple you look at it, the better is the chance that the individual will make the change.
I think
Great point.
Normalizing healthy behavior, right? And normalizing, getting up and walking to school with your kids, making it so that it's not you're the only one doing it.
Right.
So making those community changes, and it takes a community, to implement a really healthy walk to school system. Because you have to have safe places for the kids to go. You have to have parents that volunteer. There has to be things within the community, police officers that might show up and be the cross guards. So there's all different things that need to happen at the community-based level that can intervene to create this sustainable change. I do just want to say one thing about individuals, and I think that the thing that I'd like to say.
You don't agree with me?
No, I do. I totally agree with you. Because when I was thinking about this question, I think that life throws people curveballs.
Yeah.
And those curveballs can throw people off track. And it happens, and because life, there's challenges. It's not everything is Pollyanna and wonderful. And I think that, the biggest thing that you can do, and this is a Brené Brown quote, but it's be kind, for everyone is fighting a great battle. And so, and when I say be kind to your neighbor, but also be kind to yourself.
Beautiful, yeah.
And just remember that. But sustainable change is tricky, and it's important that we do it together.
So it's like the Vermont prevention model. You start with the individual, but then you really work with organizations and communities, the businesses, the schools, everybody's involved in this whole environmental piece and the policy change, like sidewalks. Creating the right environment so it's conducive to the changes that we're promoting. So that's great. All right, we talked about walking. I've heard about Walk with the Provider. So what's that all about?
Well, it's in that. Well, actually, just to.
It's a Show Up event.
It's a show, yeah. It's
Show Up
one,
event.
And
Okay.
there's one tonight. So if anybody's interested, at 5:30. So at Collins Burley, and there's one provider that comes every week to have a short discussion regarding health, and then we walk together at all our own pace. There's no challenge. You can come with your kids. You can actually bring your animals. This is something that exists all over the United States, and I kind of took the idea because I'm a member of the American College of Lifestyle Medicine, and said I think this is something that would be interested to implement. It allows the connection with the physician too. So we've already had three. And one was rained out. We've had such beautiful weather. But we had Dr. Satkin that talked about how do we kind of manage to be active with our busy life. And then we had Dr. Haig, a pediatrician, that said, how do you do this when you go and walk with children or with teen? We're going to have Katja Van Zittes tonight coming and discussing also that, really to exercise. We'll have Dr. Denise Durant. So it's a very great opportunity to kind of walk with your physician and actually ask questions about health. I mean, they're there for that. So it's great. It's a good event.
Fantastic.
Yeah, you're going to be there?
Innovative.
5:30 complex every Tuesday through July.
Through July? Okay.
Yeah, every
all right.
Tuesday through the
Great.
end of July we're doing those. Yeah.
That's super. You're kind of spontaneous. You're doing different things to keep the interest. So it's not the same thing. I mean, you're catching people in different ways.
Catching people in different ways, and I think because we're a community intervention program, like we want to hit all levels of the community and attract. I mean, people do like to do different things, right? Some people like to walk, some people like to go to boot camps, some people, have small children and can't get out and exercise, so we're trying to make it less about one activity and making it more inclusive so other people can join at every level. And it's been great. And the other thing that I would say that we're partnering a lot more intentionally with the businesses within the community and the providers and people that are all engaged already in healthy living and wellness and well-being. So that's been also really wonderful to have these community partners that are stepping up and offering either locations or time or their expertise to provide that for the community, because it's all free, it's all provided for the community at no cost.
You can do, talking about the age of social media. So people come to my office and look at their phone on Facebook, and they see that there's an event tonight, and you can sign up. And you can just say, oh yeah, I see. So they already know. You say, oh, it's good. There's a yoga event tonight. I can go. So you have something that already tells you when this is happening. So instead of having necessarily a class that always is at the same time, always the same thing, it varies, and they know that this is happening, and they just jump in. So this is our goal, is to make it easy.
It is.
Easy choice.
Easy choice.
Simplify. Make it part of your life. So the Vermont State Parks prescription program.
Yeah.
Tell us a little bit about that.
Another little thing that we're adding to this. So the Governor Council of Physical Fitness, I'm a member of that. It exists for, I don't know how many years. I've been into it for the last couple of years. And about 2 years ago, they started having this interest between the Vermont Park and the physician to encourage people to active play. So what's a better place to, go to a park and having a walk? So they designed prescription pad that the physician will use to give to patient to encourage them to go to all the park. So a free day pass to park. So I, write prescriptions. So instead of writing prescription for medication, I write a prescription to go to the park. This is great.
That is the best medication, isn't it?
Absolutely. So fresh air, outdoor, and it's becoming very popular. So like anything else at the beginning, you got to get the knowledge of it, and now people are talking about it. We were in the National Geographic this month, so
fantastic.
Yes,
that's great.
Yes, yeah.
So Rise Vermont is in Franklin and Grand Isle counties, going statewide.
Yep.
And going worldwide by the sounds of you too.
Yeah, it's Rise the Nation.
Rise the nation.
We don't like limit,
just limit it. Yeah, sure. All right, so our time is coming to a close, but maybe you both could just end by, what's the message that you want to give to the community? Just whatever comes to your mind. What's the message? What do you want to tell folks?
I think I've said it before, and I've said it many times. I want to coach a village to health.
Yeah.
And I want to make it really the simple choice of wanting to be active just for the simple pleasure of doing it. That's all. I mean, it's simple, and that's how it should be. So that's my message.
Excellent, excellent.
I think my message is we are rising. I feel right now that this county, this community, everybody is so engaged in this movement of rising and moving forward. And it's really exciting, and it's fun to see things that are happening in our community that are positive and healthy. And there's kayak racks on people's cars and bike racks, and providing access, I think, is like so important. And having, knowing where the trails are. I mean, right there, just knowing that we have such an incredible system of trails within our community, and knowing where they are. I mean, that's one of our biggest focuses as our program. Knowing that there's a lake right there, and there's plenty of parks, and the prescription program. And I don't know, I think providing access and helping people know where to go to find the information and to change behavior, and to think maybe the healthy choice is the easy choice. And that's what I want to do next. So,
Excellent, excellent.
Yeah.
Now, if a business or family want to become Rise Vermont certified, how do they get in touch with you?
We have a great website,
Okay.
risevermont.com,
Okay.
easy to access, and right on there, there's a scorecard. So it says scorecard right on the front page.
Okay.
And you can click on that. There's an individual scorecard, there's a workplace scorecard, there's a school scorecard, and a municipal scorecard. So your town, at every level we've created these, and a classroom. And so we can help you navigate those. If you need assistance, you can also just fill them out. The individual one's very simple. And you can link immediately to our health coach on our team if that's something that you're interested in. So it's
Fantastic.
easy and fun.
Excellent, excellent. Thank you both very much. We've got to run.
Okay.
But thank you so much. It's been a lot of fun, and I'm sure we'll be hearing a lot more about Rise Vermont. So.
Sure.
Thank you.
I'm Jill Barry Bowen, CEO of Northwestern Medical Center, and your host of Health Beat today. We've had a fantastic time talking about Rise Vermont and how you can become involved in making the healthy choice for you and your family. So let's get out there and active play. And I also want to let you know that this is a collaborative between Northwestern Medical Center and the Vermont Department of Health. It's been a beautiful relationship to rise the community. Thank you.